Hello, my name is Meg Ziegenfuss, and I'm a Doctor of Physical Therapy student at the University of Kentucky. Today I'm going to be discussing mindfulness and meditation and how this can be used as a tool in addiction recovery and chronic pain treatment. So what is mindfulness? So this is an exercise that focuses on the mind-body connection with the goal of inducing relaxation and serenity. It's going to be focused on awareness of present feelings, thoughts, physical sensations, and surroundings. So this could be sights, sounds, smells, or even just as simple as focusing on your breath. Mindfulness also involves accepting feelings and thoughts as they are without judging or labeling them. So it's going to challenge you to really focus in on the present moment and just focus your awareness to your breath and surroundings. So there are many different ways to achieve a meditation practice and a meditative state. So these are just a few of the most common meditation practices, and you will find many of these through many of the resources that I will share later in this presentation. So first is guided meditation. This is going to be involving forming mental images of places or situations that you find relaxing. And this could be guided with a person's voice to help you to find those images and achieve that relaxing state. Next is going to be a mantra meditation. So this is where you will be silently repeating a calming word, thought, or phrase to prevent distracting thoughts. Next is mindfulness meditation. So this is, as I mentioned on the previous slide, having an increased awareness and acceptance of living in the present moment. And lastly is yoga, which this will incorporate movement and mindfulness together. So you will be performing a series of postures and controlled breathing to promote a calm mind and flexible body. So with all of these forms of meditation, it's important to remember that you should try out many different practices to find what works best for you. What works for one person may not work for someone else. There are many benefits that mindfulness and meditation can have on the body. When an individual is in a state of chronic stress, this can create many negative health effects as a result. So during a state of chronic stress, the stress hormone known as cortisol is continuously released. This interrupts the body's natural feedback loop involving the parasympathetic and sympathetic nervous system. So these two systems help our body to react to particularly stressful situations, and then on the flip side of that, bring us back down to a relaxed state. So the sympathetic is going to be our fight or flight response. So this is what helps us to react during stressful events or situations. And then the parasympathetic system is going to be our rest and digest response. So this helps us bring us back down to a more relaxed state. So during chronic stress, the sympathetic nervous system is continuously activated and the parasympathetic response is not able to be kicked in. So activating our resting state through meditation can help to maintain the balance between these two systems. So performing meditation exercises will help to quiet the sympathetic response and then kick us into that parasympathetic relaxed state. So here are just a few more benefits that can be gained from meditation practice. It truly affects all areas of the body. So stress reduction being one of these benefits, gaining a new perspective and building skills to manage those stressful situations are other benefits of this practice. It has also been noted to increase self-awareness, increase the ability to focus on the present situation, reducing negative emotions, increasing imagination and creativity, and increasing patience and tolerance. So these are all very useful tools to help individuals deal with daily life stressors, and particularly for individuals who are in substance use disorder recovery to help deal and manage with those chronic stress patterns that can cause that imbalance in the nervous system. So here are just a few tips for beginning a mindfulness and meditation practice. Many addiction recovery programs are starting to incorporate these practices into the treatment approach. So, this is something that an individual may be exposed to during their treatment process, and it is a lifelong skill that can be continued much longer after treatment. And I will provide some resources for identifying these recovery programs towards the end of this presentation. It's also important to know that experience with these practices can vary for every person. What works for someone may not work for someone else, as I mentioned earlier. So it's very important to keep an open mind and try many varieties of these types of exercises. So it's also very important for patients to know how mindfulness and physical therapy treatment can be used in conjunction. So patients with back pain may also have altered breathing mechanics due to underutilized trunk musculature. So our postural muscles and our respiratory muscles that help us to breathe and also stabilize us throughout our day can be interconnected. So if one of these areas is not doing its job properly, it may cause the other area to compensate in some way, which results in pain. So physical therapists can help to improve breathing mechanics by strengthening deep core stabilizers and encouraging belly breathing techniques. So this may be done through therapeutic exercise or manual therapy to restore that strength and mobility in those muscles. Physical therapists may also help a patient to activate their transverse abdominis, which is one of the deep core stabilizers, and this will help to relax the diaphragm, which will further improve those breathing mechanics and help the patient to achieve better respiratory function and better relaxation. So now I'm just going to take you through one of these breathing exercises that I've been mentioning. So for the purpose of this video, I'm going to stay seated, but you can also lie down flat or whatever position you find most comfortable. So you're going to start by placing one hand on your belly, right below your ribs, and the other hand on your chest. You're then going to take a deep breath in through the nose and let your belly push your hand out. And your chest should not move during this part. So then you're going to breathe out through pursed lips as if you are whistling. And then you can feel your hand on your belly and use that to push the air out. So this can be repeated 3 to 10 times, and take your time with each breath, really getting as deep a breath as possible. And then just take a moment to notice how you feel at the end of this exercise. So this is something that can be incorporated throughout your day, during a stressful situation, whether you're at work or home or whatever the case may be. It's a very helpful tool to just help to feel more relaxed and get some better breathing. So this is just a resource that can be used to help to identify some recovery programs that offer meditation as part of their treatment approach. So this phone number is for the American Addiction Center's helpline, and this can be used to call and help to find the recovery program that best fits your needs. And here are just some additional resources for mindfulness and meditation. So there are many apps that you can find to download to your phone or other device. One of these is the Calm app. This will have a lot of guided meditations, and some are even guided by Matthew McConaughey. Another app is Headspace. This is another very similar app that can take you through some of these exercises. Insight Timer is an additional app. And then lastly, Down Dog is an app that provides yoga flows and postures that incorporate some of these exercises. The next two links here will just take you to some breathing exercises that have been provided by the University of Michigan's health website. And then lastly, there are some guided meditations online of varying lengths. There's 5 minutes, 10 minutes, up to 20 minutes, just to kind of use that to figure out what best suits you and works for you. So thank you for listening.